Hi there, my name is David Cueva. I'm staff psychologist and the program manager here at the Brooksville Clinic. This is a YouTube video about the Brooksville CBOC rotation that we have. I'm going to go through these slides that'll be available to you through this video, but also talk about the experiences that you can have here. So the next slide that we're moving to is, where is Brooksville? As you can see, we're pretty far north from the main Tampa James A. Haley Hospital. Um, we're 71 miles from there, but it's 43 miles using the Suncoast, which is a fairly inexpensive toll road that makes it a straight shot. Uh, the vast majority of us do not live actually here in the Brooksville area, so the staff providers do commute from Hillsborough, Pasco, a couple from Hernando. It is a reverse commute for the vast majority of the time, making it very easy to drive it, listen to audiobooks, podcasts, music as you're going up. So if you're considering this as a rotation, please think about that. Depending where you live, it can be very, very convenient or difficult, but I wanted to be open and honest about where we're located. Clinic information. We're a medium-sized, just right sort of clinic. One of the things that makes us stand out compared to other places is the suburban rural setting. So our patient population will be different than at the main hospital or the bigger clinics, as well as having the possibility of a mental health clinic and or PCMHI rotation, primary care and mental health integration. Treatment options here are a plethora of EBPs, which I'll get into in a little bit, some groups, and again, PCMHI. What type of internal do the best here? Someone who's open to learning, willing to try different treatment approaches. No matter what, we will be doing evidence-based treatments and or evidence-informed care. And really, you're going to gain experience here as a generalist, which in my opinion is very, very important in your career moving forward, where yes, it's great to specialize. I used to work in a PTSD program. I still do a lot of treatment with PTSD here, but you want to be able to be a generalist as well so that you can really be open to any clinic job possibility after you finish your internship and or postdoc. As I said before, you have two possibilities here, mental health clinic and PCMHI. If you were to choose the mental health clinic route, as I said before, all treatment is evidence-based and or evidence-informed. What you can expect is a mix of evaluations, individual follow-ups, which are 45 minutes to an hour, groups if available. We always have groups, but it just sort of depends on when the group started, when did you start, because all the groups we have are closed groups, so closed cohort of patients with an agenda, homework in between. Again, it is based on evidence-based treatments. The official EBPs that people are trained here and that can help you get trained on: cognitive processing therapy, prolonged exposure, interpersonal therapy, acceptance commitment therapy, and then cognitive behavioral therapy for pain. We do have an orientation group, PTSD symptom management group, mental health nursing contact group, and a coping skills group. The PTSD symptom management is 20 sessions long, very structured, based on CPT and PE, and the coping skills group is an 8-session protocol. If you were to choose a PCMHI option, what can you learn? Well, it's all about learning and developing skills related to brief evidence-informed interventions. You're going to very much get experience with CBT for chronic pain. As you can see here, there's also experience with tobacco cessation, sleep, tinnitus, etc. One of the big things related to PCMHI is develop the skills of brief functional assessments. I mean, meeting someone with a warm handoff that comes in from the primary care side of things. That's a skill that is very hard to develop, and so it'd be very good to get a taste of it and start to develop it here on internship. The other part of PCMHI is that you'll work fairly closely with the primary care team, primary care licensed providers, nursing care, Um, that idea of consultation and triage is something really important that you can gain through PCMHI. And they actually do have a tinnitus group that's co-facilitated with the audiology program. What are intern expectations? Well, we really think of this as a unique experience with the possible combination, as I said before, of the mental health clinic and PCMHI. Because of this combination, it's hard to tell you exactly what caseload will look like because it'll depend. Are you doing one or the other, or is it an and? So it's a little too hard to get into it on this YouTube video to let you know exactly. But the key is to know that you're able to possibly get two experiences in one clinical setting. So we're a multidisciplinary staff. As you can see, we have a team of 3 psychologists. One position is still vacant. We have a position of psychologists for primary care, mental health integration, with 1 position vacant. Then we have psychiatric providers, 2 psychiatrists, 1 advanced nurse practitioner with a doctorate, and then 2 mental health registered nurses who really help round us out because they are newer to us and they've really helped with orientation, walk-ins, etc. What can you expect from supervision? Well, you'll be matched with your chosen emphasis. If you choose PCMHI, you will definitely be with a PCMHI psychologist. If you choose a mental health clinic, you'll definitely be with a mental health clinic psychologist. If you choose both, we'll work out how to not overwhelm you with supervision, but certainly to get you enough so that you feel like you're getting exposed and mastering both. We'll also consider what EBPs you want to focus on, as we offer all of the ones mentioned before, but not every single one of us is the most comfortable with all of them. We will certainly have weekly individual appointments, and depending on your level and or interest, you have the possibility of having your supervisor sit in and or listen to audio recordings of your therapy sessions. Last reasons to join the Brooksville team, besides everything I talked about, is we have a lot of experience here. We're mid-career psychologists, so you're going to get a lot of experience. Some of us have worked at the VA quite a long time, but we've also worked in other settings. So you're going to get the ability to hear what it's like to work in other places, have a different perspective than the only VA way. Offices are a premium in almost all clinics. Here we have a little bit more flexibility because staff is on compressed work schedules between 4 to 10 hours plus teleworking. So you will basically always have an office available. It may not be the same office, but there'll always be one available. And as mentioned earlier, we have a different patient population than the average clinic, being rural slash suburban setting. So that's the Brooksville Clinic in a nutshell. I hope you all find it interesting. We're certainly very excited at the idea of having interns come through here, getting to know us, our population, and our clinic. If you have any questions, feel free to contact somebody from the staff, as you saw on the previous slide, and good luck in this journey of internship.